Thank you, Speaker. My question is to the Premier. This government has praised frontline workers for being heroes. However, we know that actions don't always match their words. Family-funded PSWs have been excluded from the pandemic pay. One of my constituents, Nancy Riley from Blind River, has been raising this issue and has written to the Premier, hoping to get an answer as to why she couldn't and is not receiving the top-up. Family-funded PSWs have to spend out of pocket to get their PPE and their needs, on top of having to travel from house to house, risking exposures to themselves and their patients. Why has this government excluded family-funded PSWs from pandemic pay?
Minister of Long-Term Care.
Thank you, Speaker, and thank you for the question. And first, I want to emphasize the important role that personal support workers play all across Ontario for our most vulnerable people, not only in long-term care, but in hospitals and other settings and in family settings as well. So they are truly frontline heroes. And I know the Ministry of Health has been working very hard to make sure that along with the Treasury Board, to make sure that the pandemic pay is flowed. And we certainly were looking at a wide range of frontline workers to be covered by that. The reality is that that pandemic pay is coming. It is in the process of being channeled. Not everyone has been part of that program. We know that the personal support workers are often underpaid, and we've seen that in long-term care. We understand and acknowledge the need to address that issue, particularly in long-term care. Thank you.
And the supplementary.
Again to the Premier. Frontline workers have been putting their lives at risk for the well-being of others. If someone believes they have been exposed to COVID-19, Ontario Public Health recommends they self-isolate. However, in a dispute between the Ontario Nurses Association and several long-term care home operators, an arbitrator ruled that long-term care workers voluntarily isolating aren't eligible to receive the paid leave. When someone believes they have been exposed to COVID-19, they need to self-isolate. They cannot put at risk their colleagues or their patients. Will this government ensure that all workers, and most particularly healthcare and long-term care workers, be guaranteed to have 10 paid 6 days a year?
Minister of Long-Term Care.
Thank you, Speaker, and thank you for the question. In terms of the pandemic pay, over 375,000 of Ontario's frontline and support workers across several sectors will receive pandemic pay. It is the largest of its kind in the country and is unprecedented in the province's history. And I'll say it again, our government values the commitment that our frontline workers showed day in, day out. They were there for patients in hospital, there for residents in long-term care. Absolutely critical, and we acknowledge their significance and important role. And we authorized a temporary $4 an hour pandemic premium for the next 4 months. Our long-term care personal support workers supported in that regard. And it will be provided retroactively for work performed from April 24th, 2020 to August 13th, 2020. And employees working over 100 hours per month will receive lump sum payments of $250 per month for each of the next 4 months. We value our frontline workers. Thank you for the question.